Hello, and welcome back to Nurses Notes 101. This is Alexa here. We will be talking today about cardiac and vascular catheterization. A cardiac cath, also known as a cardiac catheterization, is an insertion of a catheter into the vein or artery, usually the artery, from the groin, jugular artery, or vein, or wrist. So this cardiac catheter is then guided into the heart. This is either used just as a diagnostic tool or can be used as interventional as well, in which they can insert stents, perform ablations, and do a few other techniques to try and fix any coronary artery abnormalities. So, a diagnostic catheterization is performed to assess blood flow, pressure in the heart chambers, valves, and arteries. For interventional catheterization, it's an alternative to open heart surgery if it's possible. It can be involved in closing arterial or ventricular septal defects. Like I said previously, it can be done to place stents in narrow vessels, or it can also perform ablations to correct abnormal electrical pathways. In the picture on the left, you can see the first depiction of the coronary artery shows a lot of plaque deposits from CAD. The second depiction is a uh, utilization of a balloon mechanism to try and widen that narrowing vessel. And then in the third picture, there's a meth sheath that's put in place. After cardiac catheterization is done, usually post-op, the patient's put on aspirin. A heparin drip is also usually started, and if the patient was on Coumadin prior to a stent or a sheath being placed in, the patient will be bridged from heparin to Coumadin. After 24 hours, the pressure dressing from the cardiac catheterization can be removed. While the dressing is there and immediately post-op, it's important to assess the site for perfusion and bleeding, making sure there's no hematoma at the site. You also want to monitor for retroperitoneal bleed, which can be seen by petechiae or ecchymosis, ranging from the catheterization site into the back by the flank. And you also want to monitor for stroke symptoms, so you want to monitor the patient's mental status, alertness, orientation, because after these coronary artery or venous angiograms, the patients can throw clots. Like previously said, a complication of a cardiac cath is a stroke. Patient can also have infections, bleeding, or retroperitoneal bleed. They can suffer vessel damage from the cardiac catheterization itself or have arrhythmias. Okay, if you want to learn more about cardiac catheterizations, please do not hesitate to reach out and like and subscribe to my channel.